The RIHACOM training module, Attention and Concentration, trains selective attention. When focusing on a target-oriented action, this function is needed for differentiating important from unimportant things. Therefore, relevant stimuli can be processed, whilst all others will be suppressed. Training with this module is indicated for patients with neurological diseases such as stroke, traumatic brain injury, brain tumour, morbus Parkinson's, and multiple sclerosis, as well as for patients with psychiatric, gerontopsychiatric, and other diseases such as depression, schizophrenia, early dementia diseases, addiction diseases, and attention impairments in child and adulthood. It is important to start therapy immediately after the according diagnosis. Before starting the training module, it is possible to individualize the training parameters. Via the Therapist menu, one can adjust the level of difficulty, duration of session, instructions, help, or stressors according to the patient's needs. It is possible to change these parameters at any time during the training. In this module, the task is to find the correct object in a set of presented objects in a matrix. The reference object is shown at the side of the screen. Only one object in the matrix is identical to it. Depending on the impairment, it is possible to switch the position of the matrix and the reference object. The training begins with a low number of objects which are easy to differentiate. With rising difficulty, there will be a greater number of objects with increasing complexity. RIHACOM works auto-adaptively. The difficulty level will rise or fall depending on the patient's performance. The performance bar illustrates this development. With each change in level, the user will receive additional feedback. At the end of a training session, RIHACOM will create an evaluation graph. Training results will always be saved automatically. The patient will then continue from this stage when starting the next training session.